Our next speaker is Gandolina Melham, and they will speak on the association between international editorial staff and international publications in leading biomedical journals. Gandolina.
Hello. My name is Gandolina Melham. It's a privilege to be here presenting on behalf of my co-authors this investigation looking at geographic diversity of editorial boards, as well as geographic diversity of international publications in leading biomedical journals. So the majority of the world's disease burden lies in low and middle income countries, owing in part to socioeconomic disadvantages underlying unsafe drinking water, lack of nutritional food, lack of safe hygiene, so on and so forth, just to name a few. But despite this fact, several studies report a severe deficit in research, not only coming from low and middle income countries, but also addressing diseases common in these settings. Sorry. My apologies. Sorry about that. Furthermore, several studies have also reported that there is severe underrepresentation of individuals affiliated with low and middle income countries on the editorial boards of major biomedical journals. Nevertheless, it's unclear if increasing geographic diversity of editorial boards is correlated to increased research output in these leading journals. Hence, our objective was to investigate if there is a correlation between recruiting a diverse editorial staff and a subsequent diverse geographic output of research. Our hypothesis was that there should be a correlation due to the fact that having individuals from low and middle income countries on major editorial boards, they may be able to place contextual value on research that's being submitted, in addition to being able to hold sway on the priorities of these journals. So this was a cross-sectional study. We assessed data from biomedical journals and fields whose content covered the largest disease burden globally in 2020. Editorial staff affiliations were extracted directly from journal websites, and additionally, article study countries were determined by reviewing journal articles and abstracts directly. Our population included 5 leading biomedical journals by impact factor in the following fields. We assigned study country affiliations and study country locations according to the World Bank and classified them according to income bracket and geographic region in order to assess descriptive statistics, as well as using Spearman's row to evaluate a correlation. So to acclimate you to this table, in the first column, you can see the respective fields that were analyzed. And over in the subsequent column, you can see the total N number of editorial staff members, and then the subsequent breakdown of income bracket. As you can see, of the 3,819 editors included in our analysis, a huge majority were affiliated with high income countries, with only a very slim majority being represented in low and middle income countries. And you can kind of see how it stratifies less and less as the socioeconomic status of the category is lower. Additionally, we also found that all editors-in-chief were affiliated with high-income countries, and a large majority of associate editors were also associated with high-income countries. And the 5 editors that are associated with low-income countries had the title of International Advisory Board member. Additionally, here we can see article study countries. So again, you have the breakdown of the fields included in the analysis, as well as the total N number of journal articles that were assessed. That was about 10,000. And again, you can see a large majority of the research output in 2020 in leading biomedical journals came out of high income countries, and very, very few came from low and middle income countries. As you can see, 1,500, 500, and about 200 respectively for upper middle, lower middle, and low income. In this graph, you can see our key finding. On the y-axis, you can see the proportion of articles coming from low and middle income countries, and on the x-axis, the proportion of editorial staff members from low and middle income countries. As you can see, there is a moderate correlation that as the proportion of editorial staff increases, we do see a moderate increase in the proportion of articles being published. And just a few limitations to address is that we were only able to analyze data from 2020, since we used data that was publicly available on the journal websites, and most journals only cite their editorial boards from a given year. And as we know, 2020, the year of COVID-19, and so perhaps the distribution of publications may not necessarily represent longstanding priorities of a journal, may be skewed by research predominantly coming from China or Italy or places that were heavily impacted by the pandemic. Furthermore, analysis was limited to original research articles only, and so that may have precluded us from being able to consider maybe case series or editorials that may be more common in low-income settings. And furthermore, we were not able to assess the rate of submission or acceptance of these different journals, as we were just using data that was publicly available on websites and on in the journals themselves. And so in conclusion, we were able to find that consistently with previous work that has demonstrated severe underrepresentation of low and middle income countries on the boards of major journals, we also found that the majority of editorial board members are affiliated with high income countries. All editors in chief are from high income countries. And when individuals from low and middle income countries are included, they're often found in ancillary roles. They're seldom found in senior editor positions. But the cool thing is that we were able to find a correlation between representation and research output. And so this does indicate that some structural changes may be able to increase geographic diversity and may be able to kind of level the playing field, so to speak, in terms of editorial representation and research output, in order to be able to potentially broadcast work coming from the places where disease burden is the greatest. So of course, more research needs to be done as to what other kinds of changes would increase these efforts. But yeah, thank you.
And we're ready for questions.
Thank you for that very interesting talk on such an important topic. I'm interested if you could comment on the directionality of the correlation between articles and staff in low-income countries, because it's not clear to me that it is the presence of staff that leads to more submissions. Perhaps greater submissions or greater articles coming from a country prompts a journal to put more staff in that location. And the other question that I'm curious about is if you've looked at, sorry, I'm standing on my toes. And if you've looked at the nationality of the staff in those countries, so are putting people from high income countries in low income countries and just being present physically, or like having an affiliation or relationship enough to promote submissions and publications? Or do we need people who were born in or have a direct affiliation with those countries? And if they're located, right, if I'm born in Ghana but live in the United States and I'm on the editorial staff, is that enough to promote that affiliation?
Yeah, thank you. It's a great question. And actually, in our analysis, we weren't necessarily assessing the nationality of the editorial board members, rather their home base in terms of the institution they're affiliated with and where they spend the majority of their time. So we kind of did a little bit of digging on PubMed, a little bit of Google, LinkedIn, doing all the work to kind of try to pinpoint an accurate representation of where that individual is and in terms of how that may sway any biases that they may have. And in terms of your first question, in terms of the direction of the correlation, that's a tough question to address. Although I would say that in our analysis, that was the cumulative, looking at all of the journals and the trends of all the journals, but you can still see in cases where there are say X number of editors from XYZ setting, but that doesn't necessarily in and of itself lead to greater output from that region in one specific journal or in one specific example. But it's definitely hard to speak on the directionality just using data that's publicly available.
My name is Ulrike Müller, and I'm an editor-in-chief of a biological journal. And I work at a minority-serving, primarily undergraduate institution. And I care deeply about this topic, so I'm really glad that you gave this talk. So thank you. My question is, how much are your results confounded by the publication model? Because when you have to pay to publish, that puts an extra burden on authors and can sometimes exacerbate the results that you're finding, the non-contribution from low-income and middle-income countries. So did the journals that you studied, did they all use the same publication model? And do you have any open access journals in your study? Thank you.
That's an excellent question. And I think that just speaks to another layer of burden and another layer of another layer of the question, wherein even if there is representation, that's just another hurdle for scientists in low resource settings to be able to get their work published. We actually did not assess that particular variable in our analysis, but I think that that's a very important thing to consider when looking at publication. Yeah, thank you.
Hi, Benny Speich from University of Basel, Switzerland. Thank you very much for your talk. I was wondering about the association of editorial stuff and publications, if you also looked at the medical fields. For example, I was working with neglected tropical disease, and there's, for example, a journal called PLOS, NTDs for neglected tropical disease. And of course, there I could imagine there's more stuff from low income countries and also more publications from those countries. So did you look at this?
Yeah, we did look at, in the journals that we selected, there was a lot of research output relevant to diseases in low middle income countries, but oftentimes a lot of these research efforts are kind of co-opted by institutions in high income countries, and the leading authors and the majority of authors are often actually in high income countries and kind of just extract the data without necessarily having people on the ground in the given settings, which is another issue in and of itself that merits a whole wave of literature and investigation. But thank you
very much.
This is Florence Pratt, Georgia State University. I promise I won't even ask questions the rest of the morning. This is a follow-up question to the first questionnaire, and I think it might help you answer some questions going forward of hers, which is most of the I'm Department of Economics at Georgia State. Well over half of our grad students are international students. They have done amazing work at their countries. They know questions I have no idea. They also have contacts. They can get data that they never give me. They have done more to answer some of these questions, evaluate it, than I would ever do. The problem is, in 7 years I have been there, only one of those grad students went back to their country. They've all stayed in the US except one went to Australia. So it seems like this is so beneficial to get these and get them to recruit more. Economics are trying to get more of these in their departments. They've been kind of white male preppy for decades. But sorry, they're doing a lot better now. But anyway, But my point is, it seems like that to look at the nationality may give you a better idea of what's going on, not just the fact that our guys, my guys are staying in the US. And so you would say they're US, but they're not. And their questions are from the other countries.
Thank you for pointing that out. And that just speaks to a common phenomena of brain drain, whereby the more individuals in low and middle income countries get access to higher education, the more likely they are to actually leave that context in seeking higher paying jobs or more opportunity. And that just kind of speaks to resource disparities and kind of global power dynamics.
Hi, Carissa Cooney from Johns Hopkins. I work in surgery at Hopkins, and this puts me in mind of sort of Maslow's hierarchy of need, where one of my colleagues has an active interaction and visits a place in Zimbabwe where they've just had complete collapse of their political system, such that they don't have suture in their ORs or have to use products from the sex trade as their ultrasound gel. And so how do you address this higher level? Like if they can't even get the supplies that they need to provide care, how are they supposed to find time or brain space to publish?
Yeah, I think that's a big a big source of the problem is the fact that a lot of these countries don't necessarily have access to the resources and the infrastructure that they need in order to consistently generate high quality research or to consistently be able to address local needs. And I think that that's a big part of the problem that needs to be addressed structurally. Thank you.
Vivian Bachelet from Santiago, Chile. I'd just like to say that Chile, my country, is considered a high income country. And instead, our reality is an effect of the global South. So did you consider that many of these high-income countries, as classified by the World Bank, are not actually high-income countries? They're just very unequal countries that have some people with extremely high income and other people, the majority of the population, living in really dire circumstances.
That's an excellent point, and thank you for bringing that up. I think we can also say similarly, not similarly, but kind of similarly in the United States, where it's a high-income country with a very large GDP, and yet there's a huge population of people who are uninsured, underinsured, who don't necessarily have access to the fruits of our medical developments, technological developments. And so we did not include those nuances in our analysis, but I think that that's a very important point to bring up, is that just because a country is high income, that doesn't necessarily mean that everyone in the country is able to bear the fruits of that. Thank you.
Well, thank you very much, Candelina.